So welcome everyone to today's Lunch and Learn session. In this session, we will explore the main categories and causes of unwanted fire alarms, the operational financial consequences for property teams, practical strategies to mitigate false alarms and avoid repeat incidents, and proven methods to recover costs and manage chargeable false alarms. So we've got a couple of presenters today. I'll start with Brett Spinucci, fire systems industry lead. Brett's background, he has 20 years experience in fire alarm and monitoring, specialised in fire systems operations, fault diagnosis and false alarm reduction. He's worked extensively with fire brigades across New South Wales, Victoria and the ACT, delivering successful projects and building for builders, developers, government agencies and fire contractors. Brett is passionate about leveraging innovation, technology and data to improve fire safety, reduce disruptions and create safer, more efficient buildings. Also presenting today is Philip Yang, Director of FiftyFive Group. Philip has over 20 years experience also in the building, service and engineering, smart buildings technology and operations across hospitals, retail centres and commercial offices. Formerly head of shopping centre technology at Westfield, Spinucci Group. He's managed operations across 42 centres in Australia and New Zealand. Phil focuses on using technology and data to drive operational efficiency, compliance, and safer, smarter buildings. So just remind everyone to mute, and I think we've got a bit of a team to help us out with any questions. Guys, are you happy if people put their hand up or write a question in the chat or just call it out at the time, or would you like to wait to the end?
No,
any either and all, really.
Okay, so there's the rules of the game. If you have a question, just call it out. Otherwise, if you can remain on mute. And I think we've got a bit of a technical presentation that will obviously challenge our systems, but looking forward to the presentation. So over to you guys.
No, look, I appreciate it. Thank you, Michael, and thank you for everyone joining. I know I'm in between or during your lunch, so mindful that we are taking up valuable time. Thank you, Michael, for the introduction, and obviously we've got our team, Brett and Scarlett, on the call. And look, I really want to try to keep this interactive as possible. With the way we've structured today, there's going to be a bit of a dialogue between Brett and I. So there'll be a series of questions that I ask. Scarlett will be looking at the chat, so we'll be funneling them through and moderating them as well. But throughout the presentation, if you could please help us participate, and there are 3 polls that we want you to participate in. And by the answers we get in the polls, we can then tailor our conversation today to suit best. All you've got to do is have a smartphone with you. It's a QR code. You just scan it and then vote and submit, and you'll see the votes change real time as we go through this. So yeah, we want to try that today. So if you could all participate, that would be really greatly appreciated. As Michael's kind of given us a quick bio of our backgrounds, I thought we'd just quickly talk about what we've done in the past. So as Michael has alluded to, I used to work for Westfield or Centre Group. They are the owner and operator of 42 shopping centres in Australia, the Westfield shopping centres across Australia and New Zealand. And my role there was in the building services team in design and construction, and then later in operations and technology. And that's where, my passion for property management, technology and efficiency kind of came into play. So that's kind of where my kind of background is. Prior to that, I was at a consulting company called Norman Disney & Young, like an Arabs or an AECOM, where I was looking after electrical and fire services. I'll let Brett introduce himself around more of his background.
Back around the time that automatic fire, pardon my croaky voice too, by the way, it's something we'll just have to push through. Back in the days prior to contractor monitoring on behalf of state brigades used to do the monitoring themselves. Pardon me. So I joined the industry at the forefront where what they call the migration process was taking place, and that is where various state brigades were appointing monitoring companies to do their monitoring on their behalf. Initially, so I joined in 2002, and I joined a company called Romtech Grid, which was back then a New South Wales based and New South Wales centric organisation offering fire alarm monitoring on behalf of Fire and Rescue New South Wales, as it later became known. But I was the national sales manager, and the role really was multidisciplinary, because the brigade also come to me occasionally and say, look, you've got this problem site that keeps on generating too many alarms. Can you assist them to reduce their fire alarm load? So the role kind of changed. We had to become a little bit more analytical about how alarms were generated, why, and what we could do about it. It became quite different from there on. We then took on Victoria and the ACT, which are the private contractor monitored states. So, and I worked up until July this year, where I've stepped back and I still do some consulting work for them. But now I've joined Phil and the team at Pulse to bring that expertise and experience to a new and different client base. There's my background.
Yeah, and I think what I forgot to mention was actually how Brett and I met. I mean, we actually met in our prior roles. Romtech Grid was a fire alarm monitoring company for all Westfield assets in Australia, and I was at Westfield. So it was actually before Pulse or 55 Group where we met, got along quite well. Brett had a wealth of experience, especially around waivers and fire alarms and interpretation of different codes. And that's where we kind of, I guess, really hit it off in terms of kind of liaising with each other. And obviously, after I've left Westfield or Centre Group, this is where we are now. We've developed a product called Pulse, which I will talk about in 1 second really quickly. So look, what is Pulse? This is the only slide about Pulse, and then the rest is all about information and data. But look, Pulse, in its most simplest form, is a fire safety and risk compliance technology platform. Primary features are it helps track, manage, and reduce unwanted false fire alarms, automate manual workflows like your isolation requests and impairment process. There's a lot of times where the impairment documents need to be sent to your insurer as part of that commitment or any auditability and insurance requirements. And also deliver real-time alerts for critical infrastructure like detector valves and pumps. So we also tap into your fire panel as well as the fire alarm monitoring company to get rich and valuable data to then put that through our platform and drive actions and alerts and automations through the platform. So that's what Pulse is. And I will then go on to the next slide. So look, just quickly, some of our trusted clients, as you can see, we've got some significant presence with a lot of retail REITs, so real estate investment trust companies such as GPT Group, Mirvac, QIC, Centre Group, and also hospitals such as San Hospital. So yeah, they're kind of our customers, and we're looking for more of a portfolio type approach rather than just one shopping centre here or there. So as I mentioned, we're going to try to keep this interactive. I am quite nervous about how this is going to go. But before we kick off, because we wanted to be very specific around the audience, if you could please pull out your phone and then turn your camera on, it will then, when you point towards the QR code, it will come up with a link. And if you could just submit what state or region you're from, that would be really appreciated. So I might just give it about 30 seconds for everyone to just kind of do that interactive poll. Well, it's working.
Brilliant. Thank you for your feedback too. that's it helps us to shape today's narrative, because it's not much good me talking about the Northern Territory if nobody is represented. So we can certainly cover the states that are appearing in this poll: Vic, New South Wales, WA, Queensland, South Australia. And have we got, is that a 0 for ACT, Phil? Is that what I
That is a 0 for ACT. So we've got 20 out of 22 people that have voted so far. We'll just give it another 30 seconds for people to vote using that QR code, so we can kind of really tailor this presentation towards those regions. Okay. So, okay. Great. Well, that's let me move this QR code so you can see. Oh, you can't see the number there. But Brett, you can see from here, majority Victoria, New South Wales, which is great and interesting. And then obviously, I think that's 0 for ACT, and then some in SA and Queensland.
Yeah,
Okay.
that's good.
All right. Well, thank you for participating in that voting. There's 2 more of these, so hopefully you found it relatively easy to navigate. But this is going to really help us shape today's conversation. There you go. New South Wales just climbed. It's almost like watching a football toll or something. Okay, great. Okay, so look, I guess going into the broader facts around fire alarms. This is all around automatic fire alarms. In Australia alone, there's over 100,000 automatic fire alarms a year, which obviously cause significant disruption to businesses across the nation. 97% of these are unwanted false fire alarms, so they're not real fires, and they cause huge disruption and additional costs to a lot of the properties, especially in hospitals where patient care is the upfront most important thing. You know, if you think about 100,000, that's almost 270 fire trucks going out to different buildings a day. So it's a huge amount of public and volunteer resources that are going out to these activations. In terms of cost, we've approximated $350 million of costs across Australia per annum. We've based that on a rough cost of $1,600 per activation, which is the New South Wales rate. And Brett will then talk about what the other regions' costs and processes and procedures are. The key thing here to highlight is various and complex processes and rules in each different state and region. Obviously, we've got a lot of knowledge across different states, because if you think about Westfield, they're in every different state and region. So we've had to come up to speed and across all the different regulations there. So I guess with that, Brett, do you want to give a quick overview about what's happening with the fire brigades across different states, like process changes and policies, false alarm costs, and more importantly, impact to the operational facilities and building teams?
Yeah, sure, absolutely. Okay, so all of the brigades started out in a similar manner, in as much as all of the states did their own monitoring for the longest time. And you might remember prior to NBN rollout of fibre, we had our telephone network running on copper wires. You'd have a copper pair coming to a home. Fire alarm monitoring was conducted by the brigades themselves, often regionalised into different suburbs, and seeing as our participants are largely from New South Wales and Victoria, I can tell you that you might have a fire station, pardon me, in Ringwood or in Waverley, and that fire station would have a cabinet. That cabinet would have a series of transponders serving a geographical area of maybe 4 or 5 suburbs around. And there would be a constant pair of copper wires that ran from your premises to that fire station. And they would pass a tone along that pair of copper wires every 3 seconds. And if after 9 seconds there was not a return signal, that was considered an alarm. It's as simple as that. It went open circuit. They didn't get a tone back. Those trucks were rolling. This is true all around Australia, no matter what the state is. Obviously, it was a very fraught system, prone to people digging up lines going offline. When you've got one pair of copper wires connecting your multi-million-dollar building to your local brigade, it was not ideal to have a single path of communication. So one by one, the state started to introduce technology that made the system more robust, more reliable. They created a dual path, if you like, dual path technology. Well, they foisted this upon private contractors. I think Victoria was the first to go this way, and they engaged a company which was then known as ADT. ADT created an alarm signalling equipment that used one radio network and one copper line network. So now, if you lost one, you still had the other to transfer the alarm data from place to place. They also centralized all of the monitoring, rather than having, in the case of New South Wales and Victoria and WA, rather than having 30 odd different stations around the state monitoring alarms, having a cabinet with these transponders, they would centralised to a central monitoring station. So the central monitoring station would receive the alarm by whatever means and rebroadcast that to the brigades. So it got better and better, and we dropped out landline technology altogether and went on dual path radio of some sort. So that was the evolution of that sort of technology.
And I guess when I look at that, Brett, obviously a lot of the AAC devices, the devices that are responsible for calling the brigade, they use now dual mobile SIM backed infrastructure in case one carrier falls over, and there's a real redundancy there. In terms of false alarm charges, how do they compare state to state? Well, I think you're on mute. You're back on mute.
Apologies, I needed a darn good cough. My voice is unfortunately getting croakier. Okay, so brigades they've basically got to recover the cost of providing a truck worth somewhere between $1 to $2 million. Your basic fire truck is about $1.1 million. Something that, you talk about a high lift appliance or something like that, or a major pumper unit, and they get close to $2 million for a truck. So they've got to recover that and the cost of 6 trained firefighters to turn out to a call out. But there's an enormous variation, and nobody ever fully recovers the cost of that alarm. The brigades are always going to subsidise their costs. So your false alarm fees usually only go about halfway. South Australia is probably the lowest around the states, $645 per truck, and often they'll only send one truck. You might be unlucky. WA, 1,337 per call out per truck. Again, they would mostly only send one truck. Next up is Victoria. Now, Victoria has a minimum charge, but most often they're going to send 2 trucks. They have a minimum charge of $1,314, but then the real cost is going to be 2 trucks, so about $2,600. Queensland is $1,500, and New South Wales is around $1,600 at the moment. And you would add on various administration costs to those charges. So there's an enormous variation across the states, and it used to be funded by the Insurance Council of Australia. They're tipping in less and less money, so you're finding that the brigades are having to recover more and more costs from the user. So they're very keen to reduce the total load of fire alarms around Australia.
Yeah, and I think it's important to note there that some of these regions and states have gone up recently in terms of false fire alarm cost to the property owner or landlord. I think the likes of Victoria, ACT definitely went up. And we believe it's only a matter of time before New South Wales also goes up as well, because that $1,600 per false alarm cost to the landlord has been like that for the last, give or take, 10 years. So that will, our feeling is maybe a 40 to 50% increase in terms of that cost, but that should be something that should be budgeted and considered for any kind of future OPEX costs for your property businesses.
I just want to highlight that point because, yes, some of the charges have gone up. I think some of the states are becoming a little more realistic about what false alarms are costing them. Of all of the states, I'm most concerned at the moment about New South Wales. That $1,600 figure has been in place since 2016. So we're coming up to 9 years or beyond 9 years at the same rate. I believe that, when the rise does happen, and it's inevitable that they're going to have to increase costs, it's going to be significant. So those of you in New South Wales, if you're currently budgeting for next financial year, I would highly recommend that you consider putting in a generous margin, because I believe the potential to increase the false alarm costs in New South Wales between now and perhaps March next year, I would put at a 50% chance that that's going to happen. You've also had something of a bit of a honeymoon period in New South Wales and Victoria. In 2024 in New South Wales, there was industrial action that meant that the Fire and Rescue New South Wales attending brigade officers were recording a lot of alarms as a non-billable event. They were in industrial dispute seeking a pay rise from Fire and Rescue New South Wales, and they thought they'd be able to get the most attention by hitting Fire and Rescue where it hurts in their income stream. So for the longest period of time, I think it was about 5 or 6 months last year, there was a period where every alarm that was going out of Fire and Rescue New South Wales was being coded as a weather event or smoke from an external source. So you might find that, from 2024 to 2025, your false alarm costs have gone up significantly. And the reason for that may not be additional activations. It's just that now you're getting the full force of that. There's been another industrial action in Victoria, which has only just recently been resolved, and Fire and Rescue Victoria are now passing on false alarm charges. Now, you may have been escaping this in the past, and those of you in Victoria, and feel free to raise your hand if you've noticed this, you're now getting billed for false alarms that previously were not being billed. So maybe, again, looking at your budgets, just be cautious. I think you're about to get whacked for more false alarms than you have done in the past maybe 12 months.
Yeah, that's good. Yeah, it's a good call out, and you can see that the cost per false fire alarm varies significantly between some regions and states. I guess what we wanted to kind of explore next was, well, what can you do about it? It's all good and well to know that costs are going up, fantastic, but then it'd be really interesting to understand what many are doing currently to either recover or get reimbursed some of these false fire alarm costs. So what we've got here is a very simple, let me just skip to this slide. Oh, this slide here. it's a typical fire alarm process. And if I was to step through this left and right, how we see the world and seeing the picture is typically there's a fire alarm activation. Your panels then drop the relay to the AAC device, which is responsible for calling the brigade. Some sites might get an SMS, some might get a phone call to say the fire brigade is coming out. Then the security team, typically across the hospitals, will typically meet and escort the fire brigade to the relevant fire control room or meet them at the fire control room. That's where the response comes in. So they'll obviously meet the fire brigade, look at the panel, understand what zone, detector, or loop the alarm's going off. And like I said, 97, 98% of the times, it's going to be a false alarm. So they investigate it and they reset or clear the panel and off they go. When we've spoken to a lot of our customers, the way that they typically do this now is they record this onto a spreadsheet or just put the email that they get from their fire alarm monitoring company into a folder. And that's kind of the record of all the activations that's happened in the past. No shame in doing that. And then obviously if they need to be reviewed, they get reviewed at a later stage. From a hospital or healthcare perspective, my understanding is that there isn't a lot of direct charges to departments or, patients or anyone like that. And it'd be interesting to also know if any of the hospitals or healthcare facilities are participating in the waiver process, because there is a documented process in each state and region which allows you to apply for a reimbursement on your false fire alarm, as long as there are certain conditions that are met. Brett, did you want to talk more about this process?
Sure, the waiver process. So we in South Australia and WA, it's a very similar process. In SA and WA, the brigades themselves are monitoring using proprietary alarm signalling equipment. In WA, you only use the Chubb ASE. In South Australia, I think it's the Telstra device. The situation for waiver is similar in as much as you basically need to write a letter to your state brigade giving just cause as to why you should not be charged. In both instances, I believe the case is that the invoice arrives from the brigades and it's up to you to dispute that, to build just cause. What this requires is to have a pretty good understanding of what has actually caused the alarm and what you've done about it, and what sort of what sort of reason you can give the brigades. In Victoria has a slightly different process. In fact, it's kind of clumsy in Victoria. What they do is they actually look at each individual alarm and they assess whether it's billable or non-billable, depending on certain factors. It's not, they haven't got like an algorithm built in where they just go, this is getting billed. Although I think they're going to move more towards that, because it's getting more clumsy in Victoria trying to administer their own false alarms. In New South Wales, the process is very, very, very much clearer, where they have basically a standing set of criteria that if you can satisfy that criteria, you can claim your money back. It's always going to be billed to you. You're going to be effectively, we'll call it a fine, and it's up to you to claim that money back.
And I can see there are some really good questions coming in from, I thought it was actually Brett typing for himself, but I think it's another Brett. So there's some really good experiences and comments coming in from there. So we're going to definitely address it as well later on.
Yeah. It's, if you can moderate those, we'll answer those questions. Sure. At the appropriate. So a waiver process requires that you are in control of all of the facts surrounding that particular activation. and that you have proactively done something about it. In what is it, Phil? I think it's Victoria, where you've got to also come back to the brigades and prove that you adequately cover the service of your fire system for
Correct.
a 90-day period, which
That's right.
again is, you know, it requires a certain skill. So each and every state does have a claim process. It varies from state to state, and you know, obviously, it requires the skill of the individual. We obviously can perform these tasks on your behalf, but if you're doing it on your own, you certainly are up against it.
So I think the takeaway here is that every region and state has a different process. It can be somewhat complex. And I guess this is kind of, you know, where our background comes in terms of how to help navigate some of these reimbursement processes and automate them to a certain degree. Mindful that we've been talking for a little bit, this is our second poll. So if I can get everyone to participate in this one, I'm just trying to see. You might be able to use that original. Let me pop up the QR code again. Oh, there it is. Okay. Can everyone see that QR code? And yeah, if we could do another poll. So as before, get your phone out, scan the code, press the role you're in, and just submit, and we'll see that change real time. We'll give that about a minute to get that done. I'm so glad this is working, Brett.
Isn't technology beautiful when it does?
It'd be embarrassing if it didn't work.
Oh, I'm sure we could have gotten around.
Yeah.
It's mighty handy information to have, particularly what state of Australia the participants are in. I find that you know, in a perfect world, all of the different state brigades would use the same code. They would use the same billing criteria. Effectively, they could use the same billing amount and just unify the whole thing. But unfortunately, state by state, they like to have their own set of rules and regulations and charging methods.
So we've got 18 out of 27. So if there are those final few members completing the poll, we might give it another 20 seconds, and we'll take a snapshot of that and move forward. Okay, so
Occupational health and safety, that's such a critical position in terms of fire safety compliance. So I was just reading somebody's
yeah,
comment.
absolutely. And especially also for, you know, roles like Director of Engineering and Facilities, you know, they've got C-suites to report into in terms of providing data and visibility, making sure that they're on top of, you know, all the activations and what's happening with them.
About the changes in compliance. I mean, I think
Correct.
everybody's got to embrace 1851 and its more recent changes at the moment.
Okay.
You know, you have my sympathy.
Okay, so look, all across the board, which is great. Obviously, each one of these roles would participate in the workflow of a fire alarm activation and management at some level. But facility and operations at the top, and then Director of Engineering and Facilities, followed by admin, and then fire safety compliance and facility operations. Okay, that's really good. Thank you. Thank you for participating in that poll. So, Brett, how about data? Can data be our friend in terms of analyzing root causes, costs, and working out some proactive strategies around what some of these healthcare assets can do to proactively reduce false alarms?
Yeah, I think there's a real world difference between the information you think you have and the information you actually have, or more importantly, you know, we've all got access to certain alarm data. It's a matter of what we actually you can fit anywhere in the survey you'd like. Sorry for that person asking that question. If you run a spreadsheet, you might be able to keep a lid on your, or at least a tab on your cost. You might even be able to have a look at what are the factors or what are the buildings that are causing these alarms to occur. However, as with the caption that's on screen at the moment, the slide that's on screen, the ability to, at a glance like this, spot trends. By the way, this I'm going to stick my neck out, Phil, and say this was a New South Wales site. Would that be fair?
Yes, it was. It was a non-hospital site, so it's okay.
Okay, but I'm guessing that
This is actual data. This is actual data.
yeah. So we can see in 2024 the effect of the industrial action in New South Wales. You know, where previously you were hovering around the $200,000 a year mark. You know, thereabouts, and we've had maybe a bit of an improvement in 2023, but then all of a sudden 2024 looks the way it does. Could we just go to that other slide as well,
Sure.
mate? I rather like this. So it's one thing to keep control of your data or, again, you know, retain the emails being sent to you either by your state brigade or by your automatic fire alarm service provider. But this is an analysis of a particular site, and these are the numbers of alarms for each of the stop codes. So every state uses stop codes to classify an alarm. You know, was it a faulty smoke detector? Was it a burst sprinkler? Was it a weather event? And these stop codes determine whether it's billable or non-billable. Sometimes we kind of have a gut feeling. We go, oh yeah, I think I know what's causing that particular alarm. When indeed a representation like this at a glance will give you how much you're spending on that particular stop code. And there's another slide that unfortunately we cannot show, and it was the client's building by building analysis of what each building was costing them. So you can actually put these data traces in place, gather the data, you know, and come up with what stop codes are coming up again and again. Where are they coming up? Get positive ID on that. And what are we actually paying? And therefore, how effective our false alarm mitigation strategies are. So this information is critical. And unfortunately, I do see a gap in between the knowledge of alarm data that people think they have and the ability to critically analyze what they really have. And it's not because of ignorance, it's just because it's bloody hard. It is really difficult unless you've got a broad helicopter view of what's going on to see where best to channel your efforts and your income. If you look at this slide on screen, cooking fumes is commonly the most popular cause of alarm, and this is true in the hospital environment as well. I happen to know this client is not a hospital client, but we know that in hospitals it's a problem. Knowing how big a problem it is allows you to budget and determine what the best strategy might be to tackle that. And if the other activation is a smoke detector suspected malfunction, again, this will help you plan, does our entire detection system need upgrading? And could we actually justify on a cost-benefit analysis upgrading an entire fire system to reduce the incident of alarm through faulty equipment, through faulty detection? Therein lies the power of data. I'll give it back to you, Phil.
No, thank you for that. In terms of healthcare examples, especially around challenges that they face, is there any specific examples that we could provide the group here? But before we get into that, obviously another poll. This is the last poll, I promise. It would be great to see, and this is all anonymous, by the way. So, okay, can everyone see that there? This is all anonymous, but we just want to understand how are some of the teams on this call managing your fire alarm activations? You know, there are spreadsheets, pen and paper. They just get an email from the fire service provider. We don't know who votes on this, so it's okay. We just wanted to have a bit of a transparent conversation around how you currently track your fire alarm activations at your hospitals and healthcare assets.
Yeah, I think it's also slightly comforting for people to realise, like, you know, in the case of the second most popular response right now, we don't. Look, fair, you know, it's sort of, there is this kind of, I suppose, expectation that we're a large organisation, you know, we're a public hospital facility or whatever we are, and we generate false alarms. And there is an acceptance. You just kind of go, well, you know, we budget our $100,000, $200,000, $300,000 a year for false alarms because it's almost like a cost of doing business. So if your answer is we don't, look, fair enough. You know, I mean, it's just, you may see this as a cost of doing business. However, we also hope that you would go away from today and kind of go, maybe we could be doing more. Maybe we could be looking at the information and being a bit more critical and enacting certain changes. That's basically what we specialise in. We work with people on their fire alarm data. We give them that visibility. We work with their fire alarm contractor and we give them the information and the tools and the advice to be able to change the load of false alarms. So it doesn't just become, it's a cost of doing business. It becomes a, wow, we saved $100,000, which is not uncommon with what we see.
It's a good point, Brett. I remember one of our customers said a really interesting comment. I will just give another 20 seconds for the rest of the people to complete this poll. And this is the last poll. But I remember them saying, looking at their profit and loss statement, and in the loss element, there was a GL code that said statutory costs. So hidden under that GL code of statutory costs was false fire alarms. So they've always viewed that as something that doesn't go away or can't be reduced. They would typically increment it by 3 to 5% every year, and it'd just grow. So it was only really until we said, what's that line there? Oh, false fire alarms. Can you tell us more about that? That some of our clients realize that, oh, okay, we can do something about that and work towards it.
Yeah. And you know, I think it's unfortunately it's such a misunderstood area, particularly waivers. I remember in my time at Romtech Grid, people, when they would learn that there was a waiver process, they were almost angry because they kind of went, well, why didn't you tell me this before? We just expected that everybody knew that there was a waiver process available. So I suppose no matter what state of Australia you're currently sitting in right now, having your egg and lettuce and mayonnaise sandwich, you need to know that there is a waiver process. There is a way for you to reduce the cost of your false alarm load. And that's important and powerful information to have.
Okay, so I guess looking at that poll, spreadsheets take the top ranking there, followed by we don't, then an email from the provider. I'm assuming, and correct me if I'm wrong in the chat, that the spreadsheets are really just there to log it, so that if someone asks questions, that they've got a response to it. So it's probably not widely utilized to then track waivers being submitted to get reimbursements or to work out any active strategies to actually reduce false alarms in the future.
You know, it's a shame, you know, the benefit of 2020 hindsight. I would have suggested a fourth poll, and I would have been interested on a yes/no basis, how often people sit down with their fire alarm contractor, their maintenance contractor, and actually actively look at strategies to reduce false alarms. Your fire alarm monitoring company and your fire alarm maintenance contractor really should be at your disposal to actively recommend ways to reduce false alarms. Again, where they can't, we can, but it really is important to have that partnership and that open dialogue with your fire maintenance contractor.
Yeah, that's a great point. Maybe Brett, you can give some healthcare examples for the audience here, you know, around challenges they may face. Obviously, we can't name the hospitals, but there's general themes that can pop up. Is there anything in this space that you wanted to elaborate on?
Yeah, there's a couple of examples, and again, as Phil said, I'm not going to disclose who, but maybe you strongly identify with some of these scenarios. There's one particular. I'll turn my attention to New South Wales at the moment, because New South Wales has a process whereby, well, every state uses some sort of fire alarm number to identify your site to the brigades. But New South Wales has a particular billing method whereby they bill per automatic fire alarm number, AFA number. And what they do is they have a 60-day leniency. So in other words, if you can go 60 days without an alarm, your next one is free. But we see there's a trend at the moment to centralise these fire panels and network the entire lot back to one fire control room, which is, you know, it's powerful to have that in one place. But then they only retain one automatic fire alarm number to the brigades. Now, the chances of you going 60 days without an alarm, where you've got 30 odd panels coming back to one main FIP, is pretty darn slim. So there's one particular hospital, and it's on my to-do list, is to go and have a chat with them and get them to, sure, have one fire control room, but maybe partition up that fire panel into precincts or zones whereby they have multiple registrations at the brigades. You know, this is the accommodation, this is accommodation facility, and this is surgical, and this is oncology, and so on and so forth, so that whilst they still have the information, they could split up their automatic fire alarms and get that 60-day leniency on multiple numbers. This would actually reduce their billable false alarms. If you are in New South Wales and you want more information about this, I'm happy to provide. We'll have our email addresses at the end of this. It's a really, really good point where you can hit the optimal number of registered automatic fire alarm numbers to physically reduce the number of billable events. Billable events. You'll still have events, the billable events, that's one. Another site that I know of is actually a mental health facility. And what they do is they have a very, very, very large site. And this very large site, they've invited various tenants onto the site. And again, they have a networked system, but they're not making the individual tenants responsible for their own false alarm costs. Everything comes back to one fire panel. Everything gets billed to that institution. Yet the false alarms have actually been instigated by their tenants. They have no mechanism to recover the cost of false alarms generated by tenants and contractors. And again, this is really powerful stuff. If you've got visibility over that data and you know exactly where that alarm emanated from, it may be a billable event that you could recover your cost from that tenant or that contractor. And we see time and again that people just don't have the staff, the resources to be able to do this, or the visibility of the information. You need to have both, and it's really important to lower your operating costs. There's another hospital where they have many disparate.
Hey, Jenny, how you doing?
And different FIPs.
Is your tummy feel better?
Sorry? I can hear someone talking there.
Yeah, yeah. So they have many disparate and different FIPs around the site, and they're not interconnected, and they don't have visibility of what's going on. We've also seen, again, with this need to network panels, there's another example I saw. There's actually been a number of examples I've seen where when they program panels in a cascading manner, they get multiple alarms going to the brigade for the same one event. Unless you've got a helicopter view of the data, you're not going to spot this. It's a programming error. I see it maybe, I don't know, a couple of times a year, that multiple panels have been triggered by the same alarm event. And you may not know it. You might just be, I got an invoice from the brigades, we pay it, that's what we do. So many campuses also have poor communication. They're strong on technical, but they're poor on communication. So you might be a wonderful people manager, but you may not have technical knowledge, and you're expected to have that responsibility foisted upon you. Or the other way, you have high levels of technical knowledge of fire systems, but no real cohesive people around you to force change, and no dialogue. Again, I'm going to bring up your fire contractor because they're such an important part of this. You need to have somebody, and that fire contractor that you have servicing your property might have been given to you by your procurement department. You're not particularly thrilled to bits with that particular company. And I can almost feel some of you nodding at that statement, that your fire company was given to you by your procurement process rather than your choice, because you know they're good and you know they're communicative. So those are generally, Phil, some examples of what specifically healthcare facilities are facing at the moment.
No, thanks for the insight. I guess, look, with about 6 minutes to go, we wanted to turn to the audience. So you can now unmute or put something, maybe we'll address some of the questions in the chat. But look, I wanted to kind of express our gratitude towards everyone giving their time away to participate. If you want to contact us, our email address and our website is on the page there. Look, we do offer a obligatory free assessment of your fire alarm activations to assess, is this a problem for you or not? But I might turn to some of the chats here. So it looks like we've got actually one of our key customers here on the call, which is Trevor from Sound Hospital. So thank you for your comments. Trevor, is there anything that you wanted to, and be transparent, it's okay. Anything you wanted to kind of express with fire alarms and how the system's performed across your asset today?
Look, so one of our biggest points is obviously false alarms, and paying for an awful lot of false alarms, it does hurt your budget, an awful lot. So going through, and we didn't know about a waiver process initially, and our aim is to, go through this waiver process, start reducing our costs, and it also, the benefit is changing detectors to ultimately reduce our call-outs and false alarms. That's what it's all about. Not only just getting a waiver back, but it's putting that money into reducing the long-term false alarms. Look, the added benefit of this PULSE system from us is our reporting side. So I have to report a lot to executives and committees of how much we're spending, how many alarms we get, how do we reducing it, and so forth. So using it for predictions of our next year's budgets is it's been a massive help. So look, it's a good system that is evolving all the time, and these are we put our requests in to Phil and to PULSE the system. They're constantly updating to suit our needs. So you can't recommend it highly enough.
And Trevor, g'day mate, by the way, hello. The interesting part is that you guys have a pretty good system in place for. You were very proactive. I was really impressed with what you did in the nurses' quarters there, trying to reduce false alarms. I mean, that building is you know, it's cursed. But
It's
you know,
60 years old or something.
yeah, but you know, even under the circumstances, I was impressed that you guys had a real good understanding of what to do in that building. So more power to you, mate.
Yeah, no, look,
Yeah.
it's cost to us as well. You know, it costs us a fortune. You know, false alarms. And they're sometimes multiple per week. But and knowing where they are now, which buildings, because we run 20-something buildings, so which buildings, whereabouts, how can we reduce it? The data and real-time data is really essential for us.
And it's not unusual. Yours is a fairly small campus comparatively. You know, look something like look at something like Westmead Hospital. You know, and I think they've got, what did I hear? Is it 90 odd panels? You know, crazy number. Sorry, Phil. I'm conscious of the fact.
No. Look, yeah, look, I think that's probably good content. Look, Trevor, thank you for sharing. You didn't have to, but I appreciate it.
Thanks.
And I think also with Sound Hospital, there, you know, we're working in an environment where they've got panel upgrades going on, developments going on, along with operating a the single largest private hospital in Australia. So yeah, I think your team have done an amazing job to be able to really embrace change and innovation to drive a proactive outcome. But we haven't stopped. I mean, the first year was about identifying and recovering. Now the next year would be about reducing when things are stable. So that's the power of the data that we can actually work with your team and your contractors.
Yeah, and look, we're like most people look like on your survey. You know, we're using spreadsheets. How do you report a spreadsheet? How do you make it better? How do you reduce your costs? It does get hard. So having it digitally and that data is a massive saving.
Yeah, that's great. Appreciate it. Okay, well, look, I'm mindful of time. I hope that was a informative session for everyone on the call. I can see some people have dropped out now. Look, our email address is there on the screen, and I'm sure it'll be on the IHEA website. So yeah, look, I just wanted to say thank you for everyone to participate. And if you got any questions, please email them through.
Yeah, and so thanks, Phil and Brett, for your presentation. Very informative. Always reminds me of the old adage, if you don't measure, you can't manage.
Yep.
So clearly this is at least a great system for being able to manage it, because without that, you're just looking at spreadsheets and scratching your head. So really appreciate that. Yeah, it is. And as mentioned by Phil, yes, this is recorded and will be on our website for members to be able to watch. And as the guys have said, yes, they're very open to taking questions via their email addresses, which are on screen now, where you can get them from our website if you don't take a picture of it or write it down. Yeah, once again, thanks everyone for attending and have a good afternoon.
Thanks, everyone.
Thank you so much.